This is huge, and the way that you are structuring it is really unique. Ken, why do you think it's important to focus on Black Americans who don't have those four-year degrees?
So first of all, thanks for having us. You know, the reality of the world is that only slightly more than 20% of Black Americans do have a four-year degree. And we can talk about sort of the historical reasons why the education system hasn't really met their needs. And we know that there's some structural barriers in our society that have disproportionately affected Black Americans. All of that means that if we continue to sort of reflexively hire based on credentials rather than based on skills, then we are, in effect, keeping a lot of people who are talented but don't have access to the economy from really participating in the economy. And so I think what we're really trying to do with this coalition of 37 leading companies is to create, in effect, an economy of scale when it comes to demand, to have a demand on our side for these kinds of people. We've got to examine our own internal hiring practices and ask ourselves which jobs really do require a four-year degree versus certain skill sets. And if we can actually hire a lot of people who actually have the skill and the training, we can actually do a lot to change the country.
Ginni, you obviously ran a huge company, IBM. Job creation, opportunity distribution was a huge part of your focus, but you also know the barriers to progress. Why haven't companies been able to do this sooner on their own?
Well, actually, you know, Emily, of all 37 companies joining us, I'd have to say every one of them has tried, and in many cases successfully, doing something. But the numbers don't belie what's happened, in that we all could do better than what we're doing individually. And that's, to me, the beauty of this coalition. It's that a group of companies who said, look, individually, we can keep doing something, but it's not scaling. And part of why it doesn't scale is these structural barriers that if we work together, we each can knock them down. So Ken named one, which is around you're over-credentialing the request in a job rec for your hires. Now, I've been at this a good 8 years that you're referring to. And 8 years ago, 100% of IBM's jobs required a PhD or a university degree. We really went through and said, which ones absolutely had to have that to start, or could you have gotten the skill another way? Because we needed the employees. And we found 43% of our job requisitions today do not require that four-year degree. And then, by the way, it's 15% of our hiring last year. 75% still went on to get college degrees. And in fact, we've had our first PhD. So the structural barrier was how hiring was looked at. Then to the other side, the other barrier that this group is really going to address is, I call it the supply side. So when you go to the market to look for Black talent, there needs to be more sources of it. And today there are many community colleges, non-for-profits, very good, but all subscale, all fragmented. And as a company, you go to hire, your HR group may only be able to deal with 5, 10 of them. But now if we collectively help them scale, we can match supply and demand. And the ultimate currency is a job. And that economic opportunity is what in the end does give you racial justice. So to me, we work on all these kinds of barriers.
The targets here you're setting are really impressive. Companies are committing to hire 250 to 500 Black workers in just the first year who weren't going to be hired anyway. Ken, how will you benchmark progress over 10 years? What sort of accountability will there be?
Well, so first of all, I think the main thing is we set a real clear goal of 1 million jobs over 10 years. We knew that was a stretch goal, but we didn't want to say that we were going to do something that wasn't meaningful. So what we're asking each company to do is to make sure that they're hiring over and above what they would have done before. And I should make another point, which is that these 37 companies are sort of the vanguard for this movement. They're the early adopters, but we expect to actually expand beyond those 37 companies. We're going to use our suppliers. We're going to reach out to nonprofits. It's importantly, small to medium-sized companies, which hire the bulk of Americans in this country, are going to also be able to join this movement. So these 37 companies essentially put the seed capital down to create this startup that we're calling 110. I know your audience is used to hearing about startups. This is a different kind of startup. It's a nonprofit startup. It's to address the issue that Ginni talked about before, which is on the supply side, we have a lot of people who do a very good job of developing these people, but they're all subscale and they're fragmented. As we've gone around and talked to people, whether it's manufacturers or healthcare companies or IT companies, often there are open job requisitions right now that can't be filled because they don't know how to access black talent that actually has the skill sets. So what we're really trying to do, again, is create demand at scale that will allow us to offer those jobs that will cause the job training system, whether community colleges or whatever, to really create a situation where you're creating people who actually have these skills. And I want to make another point because we've been talking about the hiring aspect of this, and that is the other thing we're doing is we're creating a community of practice as it relates to African Americans who are employed by these companies, often with 4-year degrees. We see that there's a process inside the company where those people go into the companies and they come out. They're not progressing through the system. So you have African Americans are 13% of the population. They're about 3% of senior managers and executives in these companies. So these companies are also putting together, if you will, a community of practice to share best practices and approaches. We're approaching this with humility because we've been trying to do this for years and we haven't done it well, but we think if we actually share best practices on how we can actually advance people in our companies now, we'll also make a big difference.
It is really interesting that there will be a designated startup, as you say, with its own CEO focusing on this. Ginni, what sectors in particular are you focusing on? Where do you think, across corporate America, the most progress needs to be made?
Well, it's a great question because often the first reaction a company has is, oh, gee, I don't have any of these kind of jobs. And when you go back and look, first sector is technology. Because you look at the need for software developers, cyber people, you look at the need for cloud developers, all of this can be done with a set of credentials, not necessarily a 4-year degree to start. And then medical technicians, advanced manufacturing. So we've gone through and inventoried all the jobs where you can begin. And another point, as Ken says, we keep adding on our points, but this is not just about your first job. Our job is to be sure you can have a career. And so many of these jobs, our job is around advancement, not just hiring you. But so start with technology first, healthcare, business and finance operations, advanced manufacturing.
Now, speaking of sectors, Ken, I can't let you go without asking about your vaccine efforts. I'm sure there's a lot of opportunity for job creation there. With positive news already out of Moderna and Pfizer, what is the path for Merck to a vaccine and the latest on your efforts there?
Okay, so we have 2 vaccines in development. Obviously, they're not as advanced as Moderna and Pfizer, and those are fabulous vaccines based on the efficacy data that we see thus far. But we continue to work on vaccines that we think there will be a need for many different vaccines for different subpopulations. So we continue to do that, as well as to work on, importantly, therapeutics, antivirals, for example. We have one that's in late stage development that we actually hope will actually be able to be used for people who are infected or people who've been surrounded or being around people who've been infected, because we think this will actually help knock down the virus and prevent it from replicating. We also have another late stage drug that has pretty stunning data with respect to people who are really, really sick. The most severely ill people actually reduces the risk of deaths by about 50%. So vaccine development, also antiviral development. I think we have a lot to be optimistic about in this country, but in the near term, even with these vaccines, Moderna and Pfizer, we just got to allow them to be given to the people who need them the most. That means healthcare workers, vulnerable people, and eventually we'll have enough to roll out across the country. But that's going to take more than 6 months. So we're just going to have to heed the public health instructions about masks and keeping our social distance and our hygiene.